Life is filled with change, some of them positive and some of them challenging. Especially in this year of COVID, there have been more changes than many of us can count. Adapting to them has been really tough for some folks, whether you're 6 or 86. Here with some tips for making more effective adjustments is clinical psychologist Dr. Sharon Saline. Good morning, Dr. Saline.
Good morning, Patrick. It's beautiful to be here on this lovely sunny day.
I love having you on the show. It's funny, just before we started this conversation here in the studio, we were talking about adapting to change. So this is perfect timing.
Great. Well, so my first tip is to choose an approach. While you may not be able to predict various changes that occur day to day, you can predict with certainty that life, brings both positive and negative changes. We need to teach kids and probably ourselves how to approach these shifts so they can adjust their strategies to whatever happens and live with less worry. People develop flexibility and reduce anxiety when they can talk themselves through unexpected events and reduce anxiety by worrying less. And they can rely on coping tools that have helped them in the past. Since many kids may wrestle with recalling those events, adults can assist them by acting as their memory for their resilient moments. Talk openly with your kids, name and write down some of these tools and moments so you can all refer back to them.
So Dr. Saline, you talk about choosing an approach, which once I do that, how do I prepare myself?
Rehearse it. Practice makes progress. If your child is nervous about an upcoming shift, despite the warnings they have received about it, give them some opportunities to think through and prepare their words and actions. They will benefit from reviewing, encouraging, or reassuring things that they can say to themselves to manage in a given moment. This will not only sharpen their response, but also nurture self-confidence. Role plays, brainstorming phrases to say, considering options, including exit options if things aren't going well, all help young people improve their capacity to adapt.
Dr. Saline, if I, as a parent or a family member, see change on the horizon, should I prepare my family for that or just sort of let it evolve?
Absolutely prepare your family, particularly if you have a child or teen who is a little uncomfortable with change and when things shift. So if you're someone who hates change, that's okay. You don't have to like what's happening, but you do need to find a way to accommodate to it. You'll need to learn how to tolerate change when it arises, because it will. Giving warnings to kids about upcoming shifts, reminding them of what they will need, using daily agendas or lists, all improve flexibility. Cueing kids to check the list or the schedule instead of being a reminder machine offers a visual prompt, a map about what's coming next. Then they can prepare themselves mentally and, with your support, apply the tools you've already discussed.
Dr. Saline, I'm naturally a very positive person. I always try and see the sunny side of a situation. And when it comes to change in your family, is that the right approach? Should we always try and look at the negatives and try to put a different spin on it?
Well, first of all, you are a really positive person. It's one of the things I really love about you. It's
Thank
awesome.
you.
And yes, we want to reframe negative situations, not necessarily positive spin, but to acknowledge that there might be some challenges and how can we put different glasses on to look at them. When people struggle with change, they often struggle with anxiety and negative expectations. They have trouble altering their behaviors and emotions and may appear inflexible or rigid. Change often brings uncertainty, and this can be very uncomfortable for people. So we want, when that happens for people who don't like change, they want to avoid new experiences, people, or things. We want to help them by exploring their concerns and then going a little further. If this happens, then what? Can you tolerate that? What would your response be? Sometimes a fear of change actually just reflects a desire to avoid disappointment. So let's explore what the fear is and actually, as you said, spin it around 180 degrees so we can look at it differently.
You know, there's been so much change in the last year, and change isn't going to end today or now that the vaccine's out. There's a lot of change still coming, so we appreciate your advice and your tips. Dr. Sharon Saline, great having you on the show.
Thank you so much for having me. It's great to be here. Have a wonderful day.